On that note, we can go ahead and get started, get ready to rock and roll. So as I mentioned again, my name is Angelica Cervantes, and I'm going to be representing the YWCA San Antonio. We also have for today's panel, Johnny Harris, who is with CHCS with our Eastside clinic, and yay, woohoo! And we also have Megan Fredrick with the Now Clinic as well. In a moment, they're going to give, yes, go Megan. Awesome panel. Yes. Oh, love it. Oh my gosh, they got fans. This session is starting off awesome already.
Spanish.
Yes.
Available at ASL.
Perfect. All right. So in a minute, they're going to give a little bit more in-depth bios. I'm going to turn over the mic, especially now so we know there's fans in the room for our panelists, so that way they can do a little intro for them. So as I mentioned, today's conversation, we're going to dive in a little bit deeper regarding how do we look at increasing access to care within our communities, specifically for under-resourced communities. I definitely say when it comes to this topic, this is something that is near and dear to me on a very personal level. I have not only had the privilege of being a helper, but I have been a person that's been on the other side of the table. I've been someone in need of services. I have been somebody who, within our family, my family, have experienced domestic violence, addiction, and mental health. And I remember when I was in that situation, having to figure out where do I go, where are the resources. Till this day, I can clearly remember people not answering, getting the no's, or getting the I don't knows, or getting directed to places that had numbers that weren't working, services that weren't available, services that were closed, and already in a time of some of my most vulnerable moments, feeling even that much more lost and wondering, where is the help in my community? Where is it? During that time, I was just starting my social work education. So as a social work student going through that experience in dire need of help for, again, domestic violence, addiction, and mental health, it was devastating for me. I was just wondering, what am I going to do? What is happening? But at the same time, it also invigorated me, especially pursuing a social work education and recognizing we can do better and we can be better as a community, and being able to have better access to services. My family Spanish speaking, so being able to even find services nonetheless available for us, but to find them in Spanish at that time, to find psychiatric services in Spanish at that time, it was almost an impossible feat. But now, thankfully, we're at a different timeline, right? And it's many years now, many years of healing. So again, this is a personal note for me. So I'm excited for us as a community to be able to engage in this conversation today. So I'm going to hand it over to our panelists so they can give their introductions as well, and we can get to know them a little bit more.
All right, hello everyone. Happy Friday. My name is Johnny Harris. I'm a clinic administrator with the Center for Healthcare Services. The center is the local mental health authority for Bexar County. I'm the clinic administrator on the east side of town, the Eastside Clinic. There we do outpatient services, we provide counseling, and we also have a very special program over there, the pre-admission screening residential review program that actually oversees the mental health services for all 71 nursing homes in San Antonio as well.
Thank you. Hi, everyone. Yes, happy Friday. Thank you for being here at the end of the day with us. It sounds like you've had a wonderful day and there's great attendance, so thank you. I'm Megan Fredrick, and I am with UT Health. I'm the clinical director at our New Opportunities for Wellness program. That is sort of the sister clinic to our transitional care clinic, which has been in existence for over a decade, actually. And the Now Clinic is designed to expand access to care. So exactly what this session is about. I'm a clinician by training. I've been at UT Health for over 14 years. So creating programs and getting people access to the care they need when they need it is definitely a passion of mine. So thank you for being here.
Now I'm going to put my panelist hat on. So, in regards to the YWCA, our mission is to eliminate racism and to empower women. So we provide numerous services in the heart of the West Side community. We offer everything from childcare to after-school services, youth services, economic empowerment, workforce training programs, and then also we're in the midst of also developing housing. That's going to be focused on workforce training. So we really are focused on providing housing for women with and without children for 4 years, for them to be able to have a safe space while they're while they're going through their workforce training and educational endeavors. So, Megan and Johnny, we can start off on some questions right now. So, when we're thinking about access to care and being able to increase services, and when you think about that topic, how does increasing access to services impact the health of our overall community from your perspective?
I'll take it. Whenever you're talking about like access to care, one of the things that I always like to remind people is that there's a lot of stigma around mental health and getting that addressed, but there's not a lot of stigma around like physical health, right, or financial health or any of those things. So I've always put a counselor or a therapist, a social worker in the same category you would put your accountant. If you're able to have a cook, you would put your cook, right? The same way you'd follow up with your primary care doctor, you should keep a counselor in your pocket. And what that does is reduce the stigma. So providing people with a lot more access into getting services, the more people who get services, the less stigma that there is. But I run into it all the time whenever there's a resource fair or other things where people are a little neglectful to stop by the table, right? I feel very comfortable talking about that because obviously we're at a mental health conference. But if you do go out for your general resource conferences, there's a lot of time where a whole family will just skip by the mental health table, or they'll come up to the table and they'll say something along the lines of, I don't have any problems right now that I think I need to go to counseling for, or that I think I need to address with a psychiatric appointment. But I think they're kind of missing it, right? It's, you want to go and you want to establish a relationship with the people that are able to help you for your mental health, and that way when something does happen, right, you're not really caught into it, right? You want to have a mechanic before your car breaks down, right? Because everybody understands how stressful that is. So whenever I'm thinking about access to care, I'm thinking about reducing stigma for the future generations. So when they say that they need help with something, it's just like them saying, yeah, I need to go do my taxes. Cool, well, go to your accountant that year, right?
Thank you. And, you know, piggybacking off of what Johnny said, when I think about access to care and how it helps the overall well-being of the community, I think about the fact that what happens sort of in our hearts, right, and what happens in our head, what happens emotionally, that guides almost everything else we do. And so if we aren't addressing those things, if we aren't paying attention to what we're feeling, what we're experiencing, how we think about things, how we approach, you know, situations and problems, it's a lot harder to get through the rest of navigating life, right? The rest of getting to your other, you know, medical needs, getting through educational programs or needs, getting to your job. There's sort of a trickle-down effect that starts really on the inside. And so getting access to care, providing better access to care sort of helps people from the top down, in my experience, and that's how we are able to improve wellness and health of the community, is to get people to take care of themselves so that they can take care of everything else they need to do as adults, as citizens, as parents, as loved ones, as employees. They have to be able to take care of themselves and recognize when they need, you know, a little support.
Fantastic. And I think you definitely both are 100% just highlighting the importance of, you know, we're healthier together, right? Mind, body, and soul, right? From an individual standpoint, but also from that full-blown community level. So on that note, what is your perspective on equity, though, and racial justice, and how has that impacted our community's ability to access services across our communities?
Sure. I will go first on this one. So I think that that's it's a tough topic, right? It's a hard topic to talk about because people feel so strongly about equity, right? And what that means. People define it differently. They define it differently. They think about it differently. And at the end of the day, we're all humans. Everybody in this room is human, right? Everybody in this room is human, and everybody has the ultimate right to be their best self and have opportunities to live a life sort of abundance, whatever that means, right? Whatever that means for you and your situation. And so breaking down barriers, putting access to care in places people need them, on schedules people need it, the services they need in their community, in their home, in their neighborhood, in their schools. That is where we start to sort of get to break down those barriers and treat people all across the community, right? Every neighborhood, every walk of life, every circumstance.
Yeah, thanks, Megan, for going. Well, whenever you talk about equity, obviously that kind of brings on a certain emotion for me. You know, my grandmother was misdiagnosed with schizophrenia. She lived on the east side of San Antonio. And when I say misdiagnosis, she had a brain tumor. And I was talking to an ER psychiatrist a couple of years ago, and when I told him that, he said that's a gross misdiagnosis. And then I said, yeah, but she was a black woman in the 70s. And he completely understood, and that's all I had to tell him. We didn't have to have a deep conversation or anything about it. So when you're just thinking about making things equal for people, you have to just kind of eliminate the barriers, kind of what Megan was talking about. You got to capture them in different parts, whether that's at school, right? When a kid's going through something and the teacher recognizes it and refers them to a counselor, does that counselor know how to refer not only the student but the family, right, into the community? Or when somebody's having an emotional outburst and they're shopping at Walmart, you know, because they're going through some stuff. But there are different ways, there are really different ways of seeking equality when it comes to both race, culture, socioeconomic status. It's okay, Misty, answer it, please, because there might be a nursing home who needs some help. But you know, whenever you're thinking about that, or, you know, even that PASSAR program that I was talking about, you know, being able to capture somebody's mental health when PASSAR was the pre-admission screening and residential review, right? So all 71 nursing homes. Whenever you get somebody who's 55 plus and they end up in a nursing home, generally people just think that that person needs health care, right? Like physical health care. But a lot of the time that person's still going through life changes and they need psychiatric help, they need counselors, they need therapists, and even in that late stage. So when you're talking about everything from school to a nursing home, there's a lot of different stages in life where you can catch somebody. And so to ensure equality, you just gotta make sure you're diverse. You can't put anybody into a box. I've been sat on couches in almost every part of this city, and I've taken on problems from people from every cultural or racial background, and every single case is extremely unique. And the way that you tackle that case is you have to look at that person as a person. I've sat in people's houses who I wish I could live there, right? And you still have to acknowledge that that person's going through something, right? And kind of like the last question just brought up, mental health isn't something that can really be framed up. It affects every area of life. Whenever somebody tells me that counseling is too expensive, I said, it might be too expensive, but so is going to the mall when you're sad. Right? You're just like, I'm gonna go ahead and buy that, and that. And you know, and by the time you walk out of that mall, you could have probably paid for a couple of counseling sessions and avoided that and probably solved some other areas, right? Or during this heat when you're having some road rage, right? Those are all some like areas where just mental health comes out and kind of catches you being a little bit beside yourself. So yeah.
Yes, thank you. There was a question?
Is it okay, or do you want us to wait till we...
Yeah, no, go ahead. Ask away, my friend. Yes.
So, one of the things that I thought about when you all were talking is the inequity as far as insurance.
Yeah.
And people being able to pay for services, whether they be medical services or psychiatric services. In my line of work, I think that what I see is that there's gaps. For instance, all of a sudden, you know, a patient like can't pay because the insurance company is not going to pay. And, you know, for clinicians, they have to really provide evidence of, you know, some kind of something major, a diagnosis, in order to treat people. But I think that what's helpful if we come to a time or an age where we understand that everybody has a right to be mentally healthy and to have access to mental health, because that keeps your communities even more safe. But it's like kind of backwards to where, you know, you don't have health insurance, then you can't have the service. Or you didn't meet the criteria for you to continue these sessions. And you're talking about, and I really love what you said about the support that people need in our communities. It doesn't necessarily have to be a crisis, or it doesn't necessarily have to be, you know, but we want to support our communities, support our people, so they can make the decisions that they have to make the good decisions that they have to make to live their lives in a healthy manner.
Well, and access to behavioral health care and counseling services and all of the things we're talking about, that's prevention, right? I mean, I think that's part of what you're saying, that's prevention. And getting to a place where we can break down some of those barriers that get in the way of people taking care of themselves before things get worse. I mean, I think that's kind of what we're all echoing at this point. And insurance is a barrier. It's a real challenge. I will say that we have the great fortune, due to wonderful community relationships at UT Health in the Now Clinic, where we are able to accept people whether they have ability to pay. You can receive services if uninsured, and that's a beautiful, wonderful thing we're extremely grateful for, yet couldn't be done without community partnership, because sort of at the high level, it's not necessarily seen that way, right? It's not seen as necessary and preventative as really research shows us is the case. Yep, you are totally correct.
I love that, and again, want to highlight and lift, you know, that message again of, you know, we don't have to just wait for that crisis to emerge, right, and just sidelines and just wait until it gets bad enough, right, where we then have to intervene. You know, mental health is health, and it's something that we have to be proactive on as a community. It's something that we have to talk about it continuously. It's an everyday thing that we focus on, just as eating and drinking and maintaining a healthy diet, right? That's our mental health. It's a part of our everyday life to ensure that we are taking care of ourselves. In some of the prior sessions, a lot of the other messages that have been coming through have been how a lot of our helpers are exhausted. Right. You know, and when our helpers are getting exhausted and our helpers are struggling to find help themselves, right, that's a huge issue, right? Because now we have our helpers tapping out and our helpers getting frustrated. So also having to think of ways on, you know, how critical it's that domino effect, right? Being able to find ways to ensure that our helpers are healthy. You know, our people are getting immediate access. And we struggle, and I'll be the first one to say it, the YWCA, that's something we're trying to work on right now. It's a struggle. Our team is tired. Our team is tired across the board. You know, it's hard when you're in a constant state of vulnerability and stepping in with pure empathy, right, to assist and help. That compassion fatigue is real, and it's exhausting. And ensuring that our team is healthy mentally is critical, because that impacts the quality of care to the community that we're serving. Right, our community is already in a very vulnerable state. They need folks that are going to be in the best frame of mind, right, and in a space where they can really meet them where they're at, right, mind, body, and soul. But I have to ensure that the team is in a solid space too, and that they have immediate access to resources. I need to make sure that they're not waiting weeks and weeks to see a clinician, that they're not waiting weeks and weeks for that appointment, right? I need to make sure that those concerns are being addressed as quickly as possible. I need to make sure that as an organization, we're a safe place, we're a psychologically safe space, because that's step one, right? Because it also just can't be done everything external. So I think that's the other piece too, at looking at what everybody can do on their own accord as well, and starting that conversation, you know, even in the workspace, right, in workplaces, supervisors, managers, directors, everybody, you know, how psychologically safe are your workspaces. We spend a good chunk of our time there, more time there than at home. So those spaces have to be psychologically safe. Those spaces have to be that step one for us to introduce those conversations, that it's okay to speak up. It's okay to say something's off, something's not okay. I'm just not feeling right. I'm not feeling like I'm up to where I need to be. What do I need to do, right? And also finding ways for us to empower our organizations too, so they're equipped with knowing what the resources are, right? And where can they send their team members to get that immediate access to ensure everybody's getting that immediate health care that they possibly can. Do you guys want to add anything else? Yeah.
So the center, generally, we take clients who don't have insurance. The majority of our clients come to us without insurance. So that's what the local mental health authority does, right? In the state of Texas, every county has one. But Texas is a very unique place. When it comes to insurance, just kind of look up how we navigated the Affordable Care Act, and that kind of lets you know we have the most working uninsured in the United States. And so with that, you have individuals who have income and have no insurance. And then you have individuals who don't have income and also don't have insurance. And so whenever people come to our door, we really have to look at them in a lot of different lenses to make sure that we're able to assist them. But one of the biggest, I think really one of the largest problems right now is really clinicians. It's very, very hard to get them. It's hard to find people that are able to work with the uninsured for an extended period of time. I think like maybe before COVID, it was a little bit different where we didn't have the capacity, but I think that mental health kind of got a lens put on it during COVID. And now there's the capacity to have the clinicians, but do we have enough? And no, I don't think we do. A lot of people started addressing their mental health, which is great, but we're still very, very behind when it comes to that. You know, right now we're kind of running with the nursing crowd as far as staffing goes, and you know, it's difficult, but we understand it. Caseloads are high, right? You can try to maintain those the best that you can. When I say a caseload, that's when a clinician has a certain amount of clients attached to them, right? And they're assigned to their care. But I always tell them.
There you go.
You good? Good? All right. I always just kind of tell my clinicians, you know, we're just trying to bring in more people and trying to get y'all more help. And, you know, they're my heroes, like just straight up, man. Because I did it for 7 years out in the field and outpatient services. And so I know firsthand how difficult it is. But yeah, anybody who works in the mental health field, no matter what capacity it is, especially in the public mental health field, absolutely like my heroes, because it's a challenge right now, and a lot of people can go make more money or have a less stressful job, work in private practice right now, and the overhead's not there anymore because you can use telemedicine. So my practice is my phone, and it's enticing. And so yeah, community mental health right now we're having a little bit of a battle, but that's really the best way I can answer that question, man. But it was a really great question.
What services the Now Clinic provides and how it's similar or different from other UT health clinics?
Absolutely. Thank you for that question. Sure. Thank you for that question. So the Now Clinic we are funded on clinical contracts, actually. So that's how it differs from sort of the rest of what you hear, you know, for psychiatry at UT Health, at an academic institution. Naturally, we have all kinds of services, multi-specialty, but psychiatry has had the good fortune of having some wonderful community partners, as I mentioned, and we've had extramural funding, which is grant or contract funding, to support expansion of services for the greater part of, well, more than a decade at this point. And Now Clinic opened in the middle of the pandemic with a partnership with University Health System and STRAC, the South Texas Regional Advisory Council, is how we opened in the middle of the pandemic. We started building this program, seeing the influx in needs, seeing the increase in requests for services, and the state of really just humans, of our colleagues, of our neighbors, of our friends, because it affects us all, right? And so we developed the Now Clinic as a place that people could go upstream, right? Not when they're in crisis. Maybe before they get to that point, or they're questioning, where am I at with things? And we want to see them before it gets to the point where they think, I need to go to the hospital, or I can't take this anymore. So the intention of the Now Clinic is to get people what they need when they need it, is ultimately the goal. So it differs from the other psychiatry programs in just that it has the extramural funding. We can see uninsured folks. We try to see people as quickly as we can, depending on the service they need. It's also designed to be, there's no sort of one-size-fits-all, one track, one access point. Some people really come in and they do very well to talk to a peer support specialist in the first couple of days and then see a therapist. Maybe that's the best suited need for them. Some people need to see counseling first, or access to a social worker, or they need to see somebody in psychiatry or on the prescribing side. So we have the ability to triage which services they get when at the first phone call, essentially. Okay, there's always exceptions, and sometimes we have to discuss as a team or look at what makes the most sense, because we want to take good care of people. So that's how it differs, is that we can get people in relatively quickly, regardless of ability to pay. And we offer across the board: peer support, counseling, social work, group therapy. We've had some fun this summer adding some animal-supported therapy. So we've had therapy dogs around, which has been a great blessing, and that's been really well received. And then, of course, psychiatry services. So kind of the whole package. And we offer some treatments that aren't necessarily available in the community, and certainly not at an affordable and/or free rate. So we offer dialectical behavioral therapy, and we offer cognitive processing therapy for trauma, all of which is available if that is your need when you come to the Now Clinic.
Is that just in Bexar County?
It is Bexar County. Yes, ma'am.
Okay, so I came to this one because it says something about access to care for under-resourced communities. And it sounds like, I guess we should just have our mental health people move to Bexar County, because we don't have access to all these great things, some of them.
Sure.
But.
So you're from out of Bexar County?
Yes, we're in Kendall County.
Kendall County. Yep. So Kendall County, of course, has their own. So Johnny, and he can speak to this, is from the Center for Healthcare Services. Kendall County has the Hill Country Local Mental Health Authority, right? And so that's supposed to be that's the state's answer, right? That's the state's answer, if we're being honest. That's the state's answer to getting access to services. And Johnny can take this over, but they are county appointed. And I think we're just getting there as far as how to offer services like a Now Clinic in another county. A lot of that, because insurance doesn't pay for everything, can't be created from nothing or nowhere either. That's always our challenge when we look at some of our outlying surrounding communities, is how do we provide these services if insurance won't pay or the people are uninsured and the local mental health authority is available, but maybe it's, not quite a fit. And Johnny, please speak to that. But
Yeah, absolutely.
I was going to say, great question. And Johnny, too, as you answer that, if you can also then continue, because I think that is such an important question for us to be able to continue to explore, like the mental health deserts, right? Not even just within Bexar County, but also outside of Bexar County, right, in our surrounding areas as well. So Johnny, if you can speak on that as well, that'd be great.
Yeah, so so every county has a local mental health authority, right? But some are better staffed. So I came from West Texas, and there was a county there. They had one licensed counselor. That was it, right? The center probably has over like 70 or 80. But they thought that licensed counselor was like the end-all, be-all. They coveted him, and he could probably get anything he wants. He's got interns bringing him coffee and donuts and all the whole deal. But when you get up here, it's like, hey, we're an army of counselors, and we're ready to see them. But we're also in one of the largest cities in America, and kind of like I said, Texas has the most working uninsured. So something else that I always tell my team is, you're kind of at the top level of your game as far as dealing with uninsured clients. There's not too many people that are placed in a larger place than San Antonio with the amount of uninsured population. So kind of just to answer that question, for if you're looking at some of those deserts, I think the answer is probably going to be telemedicine. That's kind of where it's going, where every county has that local mental health authority, but the local mental health authority is probably going to have to outsource to a counselor in Dallas that you might not be able to meet face-to-face, right? But you still have access to that care. And I think that's kind of where it's going, because it's really, really hard to find counselors, social workers, LMFTs, psychiatrists out in those smaller areas. So look into telemedicine. That's probably going to be your best bet as far as like your outreach and things like that. And also, there are definitely, kind of like she said, whenever we're trying to make that model into the Now Clinic, with Bexar County, the Center for Healthcare Services being so large, we have access to that, right? We have peers. We're offering cognitive processing therapy, cognitive behavioral therapy, care managers, counselors, care navigators, psychiatrists, social workers, the whole deal. But that's not at the other counties. You're not going to find that, right? So.
Know that. That's why we're here.
Exactly, yeah. It's going to be telemedicine, yeah.
And I mean, I think, to that point, of course, we can't speak for the government, for the true policy and decision makers, but the fact that you are here and people in this room are willing to have this conversation, that is a place to start, because we keep having those conversations. We don't let the subject go. We don't let the deserts kind of go unrecognized, and continuing to brainstorm ways to look at local government, to look at the state, and relentlessly point out the deficits and the problem. Because the rural counties are growing too, right? Kendall County, Atascosa County, all of our surrounding counties, they're growing too. We are the third fastest growing city in America still, I think. So it is inevitable that it has to be addressed, and some of that comes down to such a high level decision, and or really fantastic local partners, like philanthropy partners, essentially.
Question?
My name is Lori, and I'm attached to the lady with the purple shirt. So I come from Bandera County. I have a background of 34 years in fire and EMS. Bandera County is one of the poorest counties. When there's a mental health issue in Bandera County, they literally do not know what to do with it. The jail doesn't know what to do with it.
Right.
The deputies don't know what to do with it. And they make up fake charges so they can put them in the jail. Been there, done that, dealt with this. So when there is an issue and we haven't gone to the point of being in jail, they get told, oh, well, you have to go to Kendall County and go sit in their mental health clinic, and there's only certain days of the week you can do it.
Right.
And you go and you sit for 6 hours and you pray that someone will actually see you and interview you. Otherwise, you're kicked out the door and say, okay.
Come back next time, yeah.
So then your other alternative is to go to Kerrville. Now, I have dealt with both of these agencies. They're understaffed. The therapists are in and out more than they're actually in clinic. And the doctor is a floating doctor that comes through whenever he gets around to it. So with Bandera County literally being in no man's land, nobody will go to Bandera. They'll go to Castroville, they'll go to Kerrville, they'll go to Kerrville, or to Bernie. But we sit in the middle between them. We're not even 20 to 30 minutes outside of San Antonio. With the way the city limits are going now,
Right.
we are literally bumping them. So what is it going to take when, to start off with, Bexar County pays for the San Antonio or the Bexar County Health District to provide a certain amount of coverage through university? I know that for a fact. It's on our taxes. They cover a 150-mile radius. So everybody that pays taxes, look at your bill, because you're paying for Bexar County's hospital district, which is University Hospital. So when is it going to be a point that with all the shootings and the stabbings and the kidnappings and everything else that's happening, when is it going to be a point that someone is going to step up to these outlining counties who are paying the hospital district to support them, provide us some kind of mental health services out there, whether it is telemedicine or some form of a clinician, a counselor or something, because we have nothing out there. And we have a lot of mental, we have a lot of drug, and we have
Right.
a lot of alcoholism. So I agree 100% with the lady in purple. There's a problem, and we're not that far outside.
Right.
And we pay taxes.
Ma'am? Yes. Yes, ma'am. So, yeah, property taxes, right? They're high in Texas. I think you're referring to the South Texas Regional Advisory Committee. That is the largest advisory committee in Texas. And so when you're talking about STRAC, which is the name of it, they're essentially tasked to divvying out that money. I may be wrong on this, but I'm pretty sure university is the one that collects it and then they distribute it. There are 2 programs within the Center for Healthcare Services that serve outside of Bexar County. They're both substance use based. One is called Mommies. They can serve people all the way out in Natalia. I've seen them pay for $300 Uber rides round trip without hesitation. And then there's the OSAR program for outpatient referrals, right? And so if you contact OSAR and you're outside of Baird County, they can still serve you. So with those 2 programs, that's substances, and in no way am I saying that that is enough, but that's kind of the start of it, and that's kind of where we're headed. But once again, kind of to just answer your question, it's not, funding is always needed, but this is one of the first times where I can truly say that funding isn't enough. People who can do this work need to step up, and they need to serve their communities. That's just kind of the bottom line, is we need more people who are able to do this work and willing to serve. Yeah. Yes, ma'am.
I just wanted to point out that, Texas is at the lowest realm for taking care of anything, and I bet if everybody in this room would call their representative and their senator at the state level and start pushing, that maybe we would get more funding because it's being held in place by the governor.
Yeah, absolutely. More competitive salaries is always helpful whenever you're dealing with any issues when it comes to staffing. Because you have to entice people to kind of do this work, ma'am. But yeah, if y'all need help, especially with substances, just come up to me afterwards and I'll make sure you get that contact information, because substance use does plague a lot of the rural communities, just like it plagues the urban communities. It does not differentiate. So yeah, no, that's very helpful information. But a lot of the times also, and I don't mind sharing this with anybody, whenever I hear frustrations, and this is after 10 years of working in this system, so I don't think it's easy to understand, but whenever I hear frustrations, it's also sometimes it's just a lack of knowing who to go to. It's not that the resource isn't there or the answers aren't there, but it's very hard to attain that information. And one of the reasons I think that is because you can obtain information from so many different sources now, Google and Facebook and all of that stuff. And so it's hard to kind of pinpoint one direct contact. But yes, ma'am, I would love to talk to you afterwards and definitely give you some recommendations on getting your community served for sure.
Well, and I think, sorry.
No, yeah.
And I think we hear you loud and clear. I mean, I think your point is really well taken. And so we are doing what we can little by little as we can. And these are such, big and high level conversations and challenges really. But speaking up, like staying silent about it isn't going to change the situation, that's for sure. So thank you for speaking up, right, and saying we're here and we're saying we need help and we need more access, because that allows, us even from our position to take that back to local, leaders and decision makers, certainly, among many other things that are far above that pay grade. Like you said, at the literally state level.
There's power in voice continuously, right? There has to be that collective voice, continue to advocate. And again, I think advocating for the right messages, and I know everybody in this room can communicate the right message, right? Because I think that's the other issue too. Sometimes when it's so high up and disconnected, it's not the right message, right? Decisions are being made that don't make sense to what the real issue is and what the real gap is and where things are really missing and what's really needed. Everybody in this room, we know the gap. we know where it needs to be. We know what it needs to look like. We also know what realistically, right, is what is actually needed in our different communities. So being able to speak up is 100% critical, right? Being able to use that voice continuously, right, as a collective is 100% needed. There's another hand, yeah.
So, to address your question, when you, and I've heard this in the past, not because I'm not so knowledgeable in law, because although I'm a legal assistant, you know, when we people do go and what do we do when we want something done? We get people to sign a piece of paper and we present it to the right parties, and we take that and we do something. But until somebody actually does that and signs their name and hands it over to the very next person, and then that person who wants to initiate everything takes it to the right parties, then please, by all means, sign it. We're here, why not? Let's do something. And even if nothing gets done, we, in our room, did something today, this moment. Now, I, for one, I'm here in these classes today because I know a lot of people who have mental issues. It's hard for me to talk to them. I'm very devout Christian. I've had a struggle in my life with, giving myself to the Lord's will, but I tell you what, it's worked, it's hard. I have 2 beautiful children, and I also have a 34-year-old son who's recently this year started on drugs. But it's always been my concern that I don't have the resources to get the education to help these people. And I try in my own way to do my part. But if I could get the education and I could change my career from stinking legal assistant and caring for my boss and refusing to leave him no matter how low my wages, to do it, well, I still want to wait till he retires, but in the meantime, don't let me. I can't leave him in the hands that he is. I have to be in his life. But I do want to, and he would always allow me, just like he gave me today off, he would always allow me to take classes to further an education that I want to use to help others. And I don't care if you don't get paid, I don't care about money. Money isn't the thing. Who cares? There's a lot of people in Kendall and in Bandera. There's people right outside my home that I'm able to, that I want to reach out to. But how can I, if there's no resources to teach us without us having to spend what? I can't even finish paying off my school loan from learning how to be a secretary. And my boss taught me how to be a legal assistant. I can't even afford the certificate to be a paralegal. I don't want to be an attorney. I don't want to be a paralegal. Mental health services has always been my concern. And all my life I've talked to people about Jesus and, you can change, and giving them just that smile really changes a person. So we have become a society today because of the COVID-19 issue that has gone crazy, and now we no longer talk to each other. We no longer smile. What do? We cover our faces, we look down, we try not to speak to people. Nobody gets that smile anymore. And you know what? Your smile is the best thing you can help somebody with. Because when you smile at somebody and tell them, have a blessed day, or God bless you, or hey, it was nice meeting you today, or I really appreciate you. That really helps a person more than you think, more than you know. Because when you smile at somebody and they know that you saw them, and they're not just there's so many people out there you don't even see, and they walk right in front of you. Literally, we are blind to society. And why? Because they're dirty, they're homeless, they're going crazy, doing these things, and out there. And
so I think part of what you're talking about is being an advocate. That's what you're talking about, I think. You're being an advocate. And you can be an advocate and not be a licensed mental health professional. So people in this room, right, you get to be advocates. You're hearing about services that do exist. We have a long way to go, but services that do exist and things that are out there. And now hopefully you can tell those to people that you come across, and you can share those with your neighbors and your church members and your family and your friends. And that's part of it, is being willing to talk about it and being willing to be an advocate and being willing to sort of lend a hand and offer a suggestion and make a recommendation to people you know who need it.
or people you don't know.
That's true.
I carry stuff in my car just to give, just to be able to reach out to that one person who has no shoes or no shirt, or, you know, that's my gift, my smile, my hello. Do something, people. Stop being blind, stop blinding yourself, stop turning away from them. They need you.
And I think another great avenue for that, I think you're bringing up a great point, and to also continue to lift up what Megan said, our community health workers. Our community health workers play a pivotal role in our community. They do just that. Our community health workers are our advocates. Our community health workers need to be able to have the opportunity to play a bigger role in our mental health crisis, because they can. So the YWCA, we offer training for community health workers. So if anyone is interested in wanting to become a community health worker, YWCA there is here to be able to serve and be able to meet that need, because we do need to be able to expand and be able to make that community health worker workforce stronger to address those needed workforce needs.
Now, is that an education that we're giving, that we're receiving?
YWCA actually covers the full costs for community health worker training. So that's something that, you know, again, it's part of our equity work that we do, and ensuring that we are increasing and strengthening that workforce to ensure that the advocacy is happening front and center. Yeah.
Well, my husband and I teach the family-to-family, the NAMI family-to-family course out in Bernie. And I know this is like speaking to the choir here, I realize, but if you can just, our daughter who has a mental health issue is the one who came to us after she was living with us for a couple of weeks. And I mean, she's an adult. And she said, Mom and Dad, you need to go to counseling to know how to take care of me for the rest of my life. So we called it, it's like, I don't want to pay for a counselor. I'll call Molly, because all their things. So we took the class twice, and even after the third time that we took, I turned to my husband and said, we can teach this because it's scripted, and you don't have to be educated. And if you can read, you can be a teacher for that class. And there's other classes too. So it all starts with us being educated about mental health, so that we, like my husband said, I just realized after the 6th time that we took the class or taught it, that I was actually stigmatizing my own daughter, not realizing that I couldn't get past, you know, she wasn't doing what we know the right thing to do, but she didn't know how to make that happen in her life. So if you can't do anything, call up NAMI and ask them, what can I go to? What can I learn? If you have someone, doesn't have to be a family member, it could be a friend or someone. I mean, Verna, you know, she came out with us from NAMI to talk to our pastor. And he said, well, I like this, I like NAMI, but are you going to just do it for a couple of years, or is it going to be sustainable? And we said, no, we're in it for the long haul. And so we love to teach the class to help the family members, because we know how they feel. You know, you want to help people. Today, we have 2 people here, not in this room, but at the conference from our last class, and they're just soaking it up, and they're just going to go out. So it's just do your little part.
That's right.
You know, that you can do. Learn how to love your loved one so that they can get better.
I love that, yes. And thank you again for highlighting our NAMI resources, because that's 100%. NAMI has an abundant amount of resources that are free to help us all be able to engage and be a part of the solution, right? In the middle of all this frustration and chaos, there's hope. right? That's why this conference is called Pathways to Hope, right? We are the pathway, right? We have to be able to keep that hope alive, and that is something that we can 100% do as a collective. Megan and Johnny, what's one last final message that you would like to send out on that note of how can we continue to keep that pathway of hope alive?
That's a big question, Angelica. We can probably say a lot about that.
Keeping the pathway to hope alive. Address your mental health. Just straight up, just go and get a counselor. I have one, guys. I keep one on retainer. Right? We have a very good dialogue. Like, she knows that if I'm calling, I need to get in within 2 weeks. Let's get it booked. Right? I have no problem talking to anybody about it. Mental health is just important. It is. You need to take care of it. You just need to take care of it. It's part of breaking the stigma. Tell your kids you got a counselor. Let them know what you're able to go and talk to somebody about that, and just end that stigma that was carried down through generations. Because I think it's one of the worst stigmas in America, because everybody has mental health issues. They do. When you walk outside and you trying to bust it to your car because it's so hot, that is mental health right there. You're stressing yourself out before you even start the car, right? And there are ways of actually dealing with that as you walk to your car. There's a coping mechanism that you can use, and you'll sweat less. Your body actually responds to it as well. So I think that's, if I'm going to say anything, just to be blunt, is just please go get a counselor, go get a therapist, go get a psychiatrist, whatever you need to go get it.
And I think along those lines, do what you're doing today, right? I mean, be here, be present, get involved where there are opportunities, learn about resources, share resources. I think along the stigma lines, not only taking care of yourselves, but being a voice, being an advocate, asking questions, lending a hand, speaking up, addressing things. Be human, right? Be human. And when we do that, we can help other people if they need more services, higher level of services, extended services, special programs. You're learning about special programs. You've probably heard about many of them today. And keeping those in your pocket and helping other people see it really is part of your overall wellness. It really is part of your overall sort of the human condition. It's how we take care of everything else we need to take care of, is take care of our person. Yeah.
I love that. Let's be compassionate with one another. We are each other's best resources, right? And being able to support one another in our greatest time of need, I think 100% is one of that first natural step that we can do, is being kind and compassionate with each other, right? As we all continue to navigate these waters, but again, being able to continue to hold up that hope. So any final questions for our panelists as we are at the end and getting ready to wrap up? Any last questions? No? Awesome. Well, thank you all so much. Thank you, Johnny. Thank you, Megan. Definitely appreciate your time. Thank you.